Montreal, my city. Welcome back to the morning detour. I've been away for 2 weeks, but I'm glad I'm back in the building. We brought some professionals onto the table here. This pandemic thing still continues. I'm gonna give a little oversight of where we've been so far. So in Canada, the COVID-19 virus, the cases, the total is 715,000 people. 623,000 have recovered, and we've had 18,000 and change in terms of deaths in terms of COVID-19. According to the government of Canada, they have invested $1 billion to secure access to promising vaccine candidates. So this Friday, I want to bring on a professional to help guide the people in terms of vaccination, in terms of better understanding this COVID-19 as a novel virus. So I brought on Mr. Dr. Allen. He's the professor of pediatrics at the University of Toronto. He's the chief of the Division of Infectious Diseases at the Hospital for Sick Children. He's the senior associate scientist in the Research Institute for Hospital for Sick Children. He's been cross-appointed as a professor in the Institute of Health Policy Management and Evaluation for the University of Toronto. Man, so much accreditations, Dr. Allen. He's the past director of the Infectious Disease Society of America and the fellow of the society. In 2018, he was awarded the Order of Ontario, which is the highest honor awarded by the province of Ontario. He's been a part of numerous lectures internationally, visiting professorships, greater than 300 scientific publications, more than 190 scientific abstracts, and several peer-reviewed research grants. Dr. Allen, we'd like to welcome you to the Morning Detour this morning.
Thank you. It's a pleasure to be with you.
Listen, man, there's a lot of things going on here. First and foremost, I'd like to ask you, can you please explain in your professional background what essentially is the COVID-19 virus?
So the COVID-19 virus actually is called SARS-CoV-2, SARS coronavirus 2, and it is a cousin of the SARS coronavirus 1 that caused an outbreak in 2003 through 2004.
Right.
So COVID-19 is the illness, and the virus that causes that illness is SARS-CoV-2. It's also related to another virus called the Middle East Respiratory Syndrome virus, MERS-CoV virus, and that entity has been responsible for severe cases of pneumonias, with some with pretty bad outcomes, mostly in the Middle East area. The SARS-CoV-2 virus is also related to some seasonal coronaviruses that occur each year. So it has other cousins that have been around.
So this COVID-19 is like a mutation of a whole bunch of different things coming to one. Because I'm asking you this because I'm like, we couldn't prepare for this virus in itself, because it seems like it's a mutation of several different viruses combined into one.
Basically what has happened is that although there have been coronaviruses that have been around, such as I made reference to the seasonal coronaviruses that might cause the common flu, this one isn't really a mutation of those. It's a brand new virus to which our immune system has not experienced anything like that before. And so because of that, it's called a novel coronavirus, because it's new to our immune systems. And because it's new to our immune systems, we have no immune defense against it at all. And that allows for us to easily get infected and for the infection to spread quite easily.
Listen, I love the fact you're talking about the immune system. Back in September 15th, back in 2020, for Sick Kids, you wrote an article called "Medical Researchers from Sick Kids are conducting large-scale antibody testing and data collection to understand the prevalence of COVID-19 infection in the Black Canadian communities." You go on to state that understand the level of immunity and unique risk factors for the Black Canadian population will be key to developing a robust, equitable safety measures. Can you just speak a little bit about that? How important is it for us to be testing about antibodies, and how important is data collection for specific community groups?
No, that's really a great question. If we want to get an idea of the extent to which COVID has penetrated into the Black community, antibody testing allows us to get more data than we would get simply by asking people if they ever had COVID,
Right.
because there are some people who don't have symptoms. And so antibody testing would enable the identification of people who had COVID and knew they had COVID, plus those who didn't know that they had COVID. So it allows to get a better idea of the extent to which COVID has penetrated into the community.
Right.
In addition to that, we can also determine who are the folks who are most likely to be infected. And by so doing, we can identify the risk groups in terms of the works, the occupations that people do. For example, somebody drives a taxi versus is a cashier
Yeah.
versus is a nurse, drives a public transit, is a personal support worker. All of those we can associate with the likelihood that they would have a positive test. One of the things we also plan to do in our project is to follow people over time to
Right.
see how their antibody responses change over time.
Oh, listen, man, beautiful, beautiful work. I would like to follow up with a question though, because we've been seeing a lot in the media. You know, there was this tagline that COVID-19 was hitting Black communities different than everybody else. So, from your professional opinion, is that an accurate fact or that embellishment by the national media?
So your question is it a fact that COVID is disproportionately affecting
Yeah.
the Black communities in Canada? And the answer is yes. The observations initially started around the world in Europe, where Black folks in the United Kingdom were found to be disproportionately affected by COVID. So greater numbers than their share of the population.
Mm.
The same thing was seen in the United States. And then in Canada, we're also seeing that as well. Some of the earlier data came out from Toronto, for example,
Right.
where Blacks were more likely to be affected by COVID, to have COVID, than their share of the population. And in fact, when you compare it with the white population, Blacks were disproportionately affected
Right.
compared with whites. And so it is true that Blacks are disproportionately affected. Now, the reasons why people are affected might not necessarily be aligned at all, or be explained totally on race or
Right.
genetics.
Exactly.
The social determinants of health are likely driving factors in all of this. The types of work that people do, having to do 3 jobs to make ends meet.
Yeah.
Those are the various factors that contribute. The inability to work from home. And this was clearly demonstrated in the United States, where people who were able to work from home were less likely to become infected with COVID. And they found that the white population was much more likely to work from home compared with Blacks and Hispanics. So these are all factors that contribute to the real finding, that Blacks are disproportionately affected with COVID, higher numbers proportionately for their share of the population.
Well, listen, man. See, that's what we needed, Dr. Allen. A clear picture of what's really going on, because you hear a lot of things in the media, and we just really want to focus our listeners into accurate information coming from real healthcare professionals. Okay, I'll pass it on to you. Your mic.
Again, we're here with Dr. Upton Allen, a professor of pediatrics at the University of Toronto. We're discussing COVID-19. What is COVID-19 as a disease? And I think one of the things that, a lot of people, that gave hope, I guess, to a lot of people was when the vaccine was announced.
Yes.
when the vaccines was announced, there's actually studies that have been conducted, and according to an Ipsos poll conducted exclusively for Global News, 64% of Canadians think that the inoculation should be made compulsory. Meanwhile, 72% said that they should personally take a COVID vaccine as soon as they could without hesitation, and that's a number that has gone up 20 points since November. Now, there's also, concerns about the safety of the vaccine. Some people feel that this may have been created way faster than they had imagined that a vaccine could be created, and they're discussing, some side effects. I think one of the main questions that our listeners may have is, how does the vaccine work? And is it that we are being injected with a little bit of the virus, such as other vaccines, and then we create antibodies? How does it work to protect us?
Oh, thank you very much, Kay. That's a really great question. Let me start out by saying that there are four different categories of vaccines that are being developed. And by the way, stepping back, there are more than 200 vaccines that are being developed, and only about 48 are actually currently in clinical trials.
Okay.
So many vaccines. They fall into four main categories. Category one is where one takes the SARS-CoV-2 virus that causes COVID-19, or we can call it the COVID virus for simplicity.
Yeah.
You take the COVID virus and you basically kill it and use that to develop a vaccine. An example of that type of a vaccine, of using a killed virus, would be your flu shot that you get each year as an injection. That's an example of that. The other part is that you could actually take the virus and weaken it in such a way that it doesn't cause disease, but it can stimulate your immune system. Another category would be to take different proteins from it, little pieces of proteins, and use those to stimulate your immune system. Or you could actually try to get it be delivered into the cells using another type of virus that doesn't replicate in the body. And so that type of a vaccine is being developed by AstraZeneca, Oxford, and that would be on the scene soon. But then there's another category of vaccines where you actually use nucleic acid, such as the mRNA, and that's the Pfizer vaccine and the Moderna vaccine. Those are the ones that are being given at the moment. And essentially what those do is that they basically, rather than giving you the virus or a piece of the virus, they're giving you the genetic blueprint to create a protein that the immune system sees as foreign and is able to respond to. So basically, rather than giving us the virus or protein, we're essentially giving our immune systems, giving our body the blueprint to make the protein that our body's immune systems respond to. So it's a kind of a neat technique, actually. It's fascinating, and it seems to be very effective.
Well, I think a lot of people will be very happy to learn that there's four different types of vaccine that could be made. One thing that a lot of people also, because now there's discussions about this new strand of the COVID-19 virus that has appeared, and a lot of people are wondering if that vaccine or those vaccines that are currently being developed and the one that are being distributed, people want to know if the vaccine will still be effective for that new coronavirus trend.
Yes, and that's a great question. There's no question that when you have new strains that the scientists call genetic variations, so new strains in the virus, and you develop a vaccine directed at that, and then the virus changes, that there's always a chance that the vaccine might not be as effective. But that said, when changes occur to result in a major effect on the vaccine, we're talking about significant variations. We're talking about major changes as opposed to smaller changes.
Okay.
Now, okay, I should mention two other things. One is that the current mRNA vaccines, the Pfizer vaccine and the Moderna vaccine, they're about 95% effective. That's really wonderful compared with, other vaccines that are like, measles vaccines, like 98% effective, So that's really very good. So the point then is that if for some reason strains cause the effectiveness or the efficacy rather to drop from 95 to say 80%, that's still super great. So we're starting off from a really good, level of efficacy, and if we drop a little bit, we're still pretty good. But there's one other point that is worth noting, and that is the mRNA vaccines were developed in such a way that because you're actually creating the blueprint, you can literally go back to your laboratory and rejig, fine-tune the blueprint within a short period of time, which is kind of really neat. It's the way that I think about it is that you're baking cookies in a baking pan, and you see the shape of the cookies. Overnight you could change the shape of the baking pan, and next day you have some different cookies. It's that concept of the blueprint. But it's a really great question.
Yeah, I think people will be reassured to at least know that the efficacy, because people were questioning if 95% was enough. But I guess also we need to get the public more educated on maybe how vaccines work in general, so that we have more knowledge. When it comes to that specific vaccine, a lot of people try to, find information and wondering if they should be taking the vaccine or not. And there's reports that despite the COVID-19 death count, for example, in the United States, that were rapidly accelerating, there was a high percentage of healthcare professional and frontline workers throughout the country who have been prioritized as early receipt for coronavirus vaccines, such as in Canada, they have been prioritized as well. But there's a lot of people that are still reportedly hesitant or outright refusing to take that vaccine, despite the scientific evidence that the vaccines are safe and effective. And also other things that were mentioned at some point is that if someone has strong allergies, that they should not be taking the vaccine. So in your professional opinion, in which should people get vaccinated? But really, what could you say to the people when it comes to those allergies and the people that are still hesitating to take that vaccine?
Well, what I can say is that being a bit hesitant is normal. If you had asked me, June of last year, if I would take the vaccine, I would say, well, I just need some more information. Well, I have that information, and I hope that I can share that information with others. I had my first dose of the vaccine last week.
And you look great too, sir. You look great. So you see some things, people took the vaccine and their bodies. You look great. You look healthier than me. You shine.
I'm fine. So the next point I want to make around that is that being hesitant is fine, but part of that is ensuring that people have the right information to make a decision. And I think that one of the challenges that we and the media, yourself, we all have to work at is just ensuring that people have the right information. Because it would be really sad for us if we find that people, including members of the Black community, do not get vaccinated. And the reason they don't get vaccinated is that they acted on wrong information. And there's a lot of wrong information that is circulating right now. And so we should try to correct that. Now, with respect to your question of allergies, yes, it has been observed that some people might have allergic reactions to the vaccines, but the current evidence supports vaccinating people who have severe allergies still. They can still be vaccinated. It just means that, and I'll explain why that is so in a moment, it just means that they will observe you for a longer period after you get vaccinated. When I got vaccinated, I waited for 15 minutes and then, I was good to go.
Yeah.
But somebody with severe allergies, they'll keep them a bit longer, half an hour at least, to make sure everything is okay. Now, the reason why severe allergies still allow us to be vaccinated is that if you're allergic to, if you have a major allergy to something like, let's say, I don't know, penicillin.
Yeah.
Let's say you have a major, you can be anaphylactic. The key thing is, are you also allergic to what's in the vaccine vial? And what's in the vaccine vial would not necessarily cross-react with your penicillin allergy. And the ingredients in the vaccine vial are reasonably straightforward. Some people can react to what's in there, but it's reasonably straightforward. There's some sodium salts, potassium salts, sugar, water, and some fat, some lipid. One of those lipids is one called PEG, the shortened version of that, and people would think people are reacting to that entity. So it's a matter of trying to figure out what exactly the person is allergic to, and whether or not they're allergic to any components that are in the vaccine vial.
Oh man, this is good, man. I feel so informed. I'm about to go back and look at this video. The video for this interview will be available on our YouTube, The Morning Detour. For those that want to see the Dr. Allen speak his truth, really explain to us. Because man, I felt so misinformed going online and trying to read about the vaccine. Okay.
Definitely. I think the last question that I have for you, that a lot of people are wondering, is what is the percentage of population in Canada that needs to be vaccinated in order for us to get out of this pandemic that we're in? Because I think people are starting to really get tired of, mentally and physically tired of, this quarantine and things of that nature.
Yeah, that's another great question. I should come back and talk to you guys sometime.
Listen, come back all the time. We need you. We need you, Dr.
Wonderful
Allen.
question. You're getting at an entity we refer to as herd immunity. And it basically means what proportion of the population needs to be vaccinated to essentially interrupt spread in a manageable, predictable way. And you'll see estimates vary to the low end of 65 and probably more up to closer to 80. So if we had 70 to 75% of the population vaccinated, we would likely be okay. So we're in that zone. And the way to think of the herd immunity, it's almost like imagining a forest fire, and you want to interrupt the spread of the forest fire. And what the firefighters will do is that they would run ahead of the fire and clear certain plants and brushings and just to make for there to be a spot where when the fire reaches that spot, it stops and doesn't go any further. And that's the concept of what vaccination is doing. It will allow the virus to just affect people who are susceptible, but when it reaches you or me and we are vaccinated, it doesn't go any further. And that's the whole concept of herd protection, herd immunity.
Well, listen,
Thank
Kate.
you so much for the information. That's nice.
Dr. Allen needs to put out a mixtape. Look, I love your metaphors. I love how you simplify it in layman's terms for the general public. My last question here for you, Dr. Allen, you do have a Jamaican background, and we do have a large population of the Black community that do listen to our show. And a lot of people, especially the older West Indian folks, they tend to just rely on the natural herbs and roots. My mom is still making me the bush tea every couple of days. A lot of people are relying on the D3 and the vitamin C. Where do you kind of land on that with the natural herbs and remedies from the West Indies, opposed to the vaccination that's for the most part has been proven effective?
So I have good news and not so good news for you.
This is the place for it.
The not so good news is that to date we have no evidence that the various herbal medications, herbal supplements, bush tea, anything, noni juice. We have no evidence that those treat or prevent COVID. And that said, in coping with any illness at all, or trying to prevent any illness, staying well is important. And if taking those various types of supplements and eating well and exercising well keep you well and allow you not to be frail, that's a good thing. It's just that it's part of generally staying well rather than specifically protecting you from COVID.
Oh man. Well, listen, you can have your bush tea, but you might have to add the vaccination to your mental regimen as well. Montreal City, we've been speaking to Dr. Alan Lisset, Chief of the Division of Infectious Disease for the Hospital for Sick Children, amongst many plethora of other degrees that he has as well. Dr. Allen, please come back on the show. As much as we get more knowledge, as much as they tweak the kind of the blueprint, please come back on the show to inform the general public so we know the information is accurate and it's good, because you're on the front lines researching and really trying to move this along properly for our Black community.
Thank you so much. It's such a pleasure to be with you both today.
All right, perfect.
Thank you.
The Morning Detour on CKUT 90.3 FM.